Firstly, we want to thank you. This work wouldn't be possible without you. As you'll see in this video, your voices are integral to this project. You're serving as experts in your experiences. What's this project? It's called Engaging Community Hospice Partners to address social, ethical, and behavioral barriers to COVID-19 vaccination for home health aides. We'll describe what this means very soon. As we get started, I'm sure you're wondering, how can I share my thoughts? What's a community engagement studio? A community engagement studio is fancy talk for what we're going to start doing together. Together, you're an expert panel. As researchers, we want your reactions to help home hospice and palliative care agencies develop materials around COVID-19 vaccines. This project aims to create a practical communication toolkit consistent with common cultural beliefs and values among home health aides to encourage COVID-19 vaccination. We'll share what we've learned so far, talking to people like you and some hospice agency leaders and administrators regarding COVID-19 vaccines. This project involves 2 parts. In part 1, we're talking to home health aides and administrative leaders from a diverse sample of hospice agencies. We plan to speak to around 20 people. In part 2, we gather an expert panel in the community engagement studios. This is a structured way to obtain feedback. We aim to take these 2 project parts, interviews and community engagement studios, and create a practical communication toolkit consistent with your cultural beliefs and values to encourage COVID-19 vaccination. Our hope is to build trust, reduce misinformation, and encourage vaccination in respectful and informative ways, not coercive or manipulative. Our goal is to create materials that help people make better decisions about their own health and their loved ones' health. In the U.S., there's a comparatively low vaccination rate among what some call the frontline invisible workforce of home health aides. So, we're motivated to increase awareness so that direct care workers can trust the information they're given. As a result, our interviews explore the individual, family, organizational, and community level barriers and facilitators to COVID-19 vaccination. Here's a framework that can help us understand this complex issue. It's called the PEN3 framework. In each circle, there's a word that begins with P, E, and N. So that's where we got PEN3. The picture shows concepts around cultural empowerment, identity, relationships, and expectations. In real-world terms, who you are, your experiences, and your cultural background matter. Therefore, we want you to speak up to help us design a communication toolkit that can work for you and others in this field. We've conducted around 20 interviews, 13 with home health aides and 7 with leaders. We're already noticing things that seem important, which we'll share in the video. We want you to feel free to agree or disagree with, or add these ideas in our discussions. We divide our themes into 2 buckets around the COVID vaccine. 1. Message formatting. 2. Message content. In terms of format, we've learned 3 lessons. First, frontline healthcare workers prefer messaging as little seeds, not standalone lectures that could last up to an hour. We heard that small nuggets of material may help you make a better decision about the vaccine. The second is allowing for person-to-person Q&A about the vaccine. However, this was challenging or impossible at times. The third lesson is that we want to be sensitive to people's technology. For example, using text messaging was preferred rather than emails or other internet-based messages. We've also learned 3 lessons about message content. First, people want balanced information on the risks and benefit of the vaccine, not information slanted too far one way or the other. Second, people like personal narratives, stories of other healthcare workers who've had the vaccine and how it's helped them. Third, There is a question of whether messaging from the home health agency should be branded as something from the organization or from a trusted third party, such as the CDC, the Center for Disease Control and Prevention, the federal government, or other places. There's one bigger issue we've heard about. We call this the gap. This sometimes happens between the frontline home health professionals and agency leadership. Here, leaders perceive they are sending out vaccine-related messages. However, when we talk to home health aides, they tell us they haven't heard them. So, there's a gap between the leaders and the direct care workers that needs filling. Both leaders and home health aides have a shared concern for protecting their vulnerable patients, which could be something to build upon to bridge this gap. Here are some of the conclusions and what our next steps are. Importantly, we think there's a communication gap between hospice and palliative care agency leaders and the home health aides and other professionals delivering care to vulnerable patients in their homes. But we think bridging this gap is possible by recognizing the shared concern for protecting vulnerable patients under the care of home health aides and agencies. Second, we think that elevating and empowering the voices of frontline home health aides can reveal key insights about the format and the content of possible messaging around COVID-19 vaccines. And this is where you come in. We want your help in using the findings from the interviews to create practical, culturally important communication toolkit materials that help people make better decisions about their health when it comes to COVID-19 vaccines. Thank you. We hope it was helpful, and we look forward to furthering the discussion.